Hey, well, good morning and good afternoon to everybody who's joining us right now, depending on the coast you're on. We have such an exciting session today and a really great panel of experts to speak to it. I'm just going to get started for the sake of being timely. So we are solving for family-based communications in healthcare today with, as I mentioned, a really great group of folks. I'm going to let me introduce myself. So I'm Carrie Scott. I work at Spruce Health. I lead marketing here. I will intro the rest of the group, but just some quick housekeeping. We definitely want to make this an engaging session where you feel immersed and you can ask questions. Please drop those questions into the Q&A. We've disabled chat. It's just a lot easier to manage in the Q&A. So please feel free to do that. We'll answer them as we're going. If something isn't necessarily relevant to the slide or the topic we're on, we'll save it to the end. But know that your questions will be answered. Michelle, I'm going to have you just move to the next screen because we're going to run through the agenda real quick. Perfect. So in a second, I'm going to intro these lovely folks here that you see their small photos on the right of your screen. I'll tell you quickly what Spruce is in case you aren't already familiar. And then we're going to touch on the challenges that we're seeing today in family-based communications and how they can be solved for. We're going to dip into unified communication and contact management, secure messaging, and more. The questions at the end will be to, again, cover those that don't necessarily relate to what we're talking about on each slide, but we will also answer them as we go. So one more point, this session will be recorded. So if for some reason you have to drop off or you feel you've missed something, I will be sending out the recording after we wrap and you can go back and watch it again and go back to those areas of interest. So don't worry about missing anything. Next slide. Perfect. So here is our expert panel. I'm just going to start right there, top left. So we have Dr. Oded Herbsman joining us. He's a pediatrician and a chief medical officer at Discover Health Medical Group. Very excited to have you with us, Dr. Herbsman. We have Dr. Carleen McMillan. She is a child and adolescent psychiatrist, and she is the chief medical officer at Osmind. Carleen, we are so excited to have you. I'm using a first name because I feel like I know you. Dropping down, Dr. Amy Couturier, pediatrician and owner at Up North Pediatrics. Dr. Couturier, thank you so much for joining us today. And lastly, we have Michelle Bruen. I am very excited to have her moderating this today. She's our implementation specialist at Spruce Health, and she is so well-versed on this and many other things, and she is just going to make for an excellent host today. So there's your roundup. I'm sure we'll dig in a little bit more on what all these folks are working on every day, but that gives you an at a glance, high level, here's who we're going to be hearing from today. So the next slide is just for anyone joining us who is not familiar with Spruce, although I think most of you probably are. The nutshell version is that Spruce is a healthcare communication platform that has been designed specifically for anyone in the medical profession. And of course, it delivers easy HIPAA compliance, which is a big one for most of us. It does consolidate communication channels, including business phone and fax and text and telemedicine, video, et cetera, into one unified solution. Some folks like to refer to it as their office in their pocket. I always love hearing that. It can be game-changing for folks. And I think that's one of the things we're going to be talking about today and how to get the most out of Spruce. So that's Spruce in a nutshell. And with that, I believe I'm going to be passing the torch to Michelle and letting her take this away. So please enjoy this discussion. Again, please drop any questions you have into the Q&A because we want to answer them in real time. That's kind of the beauty of having these folks live with us today. On to you, Michelle. Thank you.
Thanks so much, Carrie. And thank you all three of you for being here today. So in my work with Spruce, one of the things that I do is work with new practices who are coming into Spruce and figuring out how to use Spruce to communicate with families for the first time. And this is something that I think we are continuing to learn more about how our customers are using Spruce for this sort of function and how we can best support practices like this. And I was really excited to have a conversation about how we're using Spruce to communicate with families now and ways that we intend to improve this, how this is really influencing how each of you is running your own practices at this time. So thank you so much for being here. The challenges, to communicating with families when you're working with families now, I think we have huge volumes of communications. You have difficulty keeping track of who you're communicating with. There can be a lot of inaccurate and inefficient ways of transferring information, problems communicating with more than one parent or caregiver, and office visits that are happening for things that are straightforward because families aren't able to share information with their providers in a secure way. So we feel that Spruce is definitely working to solve a lot of these challenges and has features that are applicable to these challenges. We really feel that our workflows and being able to communicate in secure messaging and text can solve a lot of administrative problems. Things like saved messages can add to efficiency. We have different ways of handling urgent communications, different kinds of call handlings. So these are some of the ways that Spruce adapts to this set of problems. And we're just going to really deep dive into some of these individually to kind of think about what the issue is and how all of you might be working through this now. So unified communication is one part of this. And I know that Dr. Herbsman's practice does a lot of internal communication to manage how they're handling communication with patients. So this is just an image of a secure conversation with a pretend parent. That picture is my daughter, who has just turned a year old. And I desperately wish my pediatrician had Spruce, although I would probably drive her insane because I would need to ask her about every single thing that my daughter does. I'm a first-time parent. That's probably true for a lot of your first-time parents you might interact with as well. So here, what I'm demonstrating in this image is just that the parent has reached out. They're able to send an image, which in and of itself, I think is a big leap forward for communication. And that there is an internal message here where the doctor has been paged, has been internally notified, saying, hey, what's your opinion on this? So Dr. Herbsman, I know that you've told me that you use a lot of internal communication in your practice. Can you tell us a little bit about how that works for you?
Of course, thank you. So I think we've been with Spruce since 2012 or 13. So we kind of grew with you and you grew with us. And we were, I think, a challenge to you because I think we were one of the first pediatric groups. So there's a lot of learning for both sides in terms of, it's not a adult with a cell phone. It's 4 kids with mom's cell phone. So there's sort of a lot of learning and fine tuning. We basically were able to take Spruce and replace our insecure texting to our personal phone and Slack, because we used to use Slack. Spruce works really well for us. If a mom, and I'm assuming everybody here is a pediatrician, but if a mom texts me about Johnny and I said, Johnny needs this, but I want the office to send him this form and I want them scheduled for an appointment with me, I'll go to internal communication and I'll add page either my scheduling, like we have a lot of teams. So I have a team for scheduling, I have a team for the MAs, and I have team for medical records and billing and things like that. So I can basically Slack whoever I want. Sorry, I shouldn't use the word Slack, that's the enemy, but I would add page whoever I want. The other thing that's really useful is for us, we have 3 pediatricians in a group and we take turns every third night. And so the biggest tool for us is sign out. Like instead of getting on a phone and spending 20 minutes going over everything, assuming the other person has the time to write it down, I'll add page my partners and say, this is going to come up tonight. Here's what it is. Or also, can you follow up on these labs for me on the weekends? This is my sign up, but also to use it for asking advice. We get a lot of pictures of rashes, a lot, like an incredible amount. And then if I'm not sure, I can basically add page one of my partners or both of them at once and say, what do you think we should do here? And finally, I think we have adult medicine and pediatric medicine in the same practice. It's really, really helpful when you take care of a family. We take care of 3 generations. like my adult person will say, hey, I was visiting the mom and she expressed concern about her daughter doing something or another, or I just tested her, she's COVID positive, you might want to consider testing her kid or something like that. So I would say that internal communication is probably for 40% of my business is just classifying it this way or another. And it's really, really godsend to nothing falls through the cracks. That's it.
Mhm.
Awesome. Now, I know, Dr. McMillan, you are a child and adolescent psychiatrist, and so you're working with families, but in a little bit of a different capacity than a pediatrician. Do you also use internal communication in your practice? Is that relevant to you?
Absolutely. Yeah, absolutely. So we've been with Spruce since 2016, and I think we're probably one of the first mental health psychiatry practices. So similarly kind of grew up with it. And from day one, the internal communication has been essential for us, both administratively. So like Dr. Herbstman, we have, like an intake group, an admin group, and we can easily page kind of, I don't have to know who's on that day. I can just page that group, and whoever is working can kind of sign themselves in and out to that channel. We've also used it in psychiatry regarding like if there's a crisis, right? So hopefully I'm not getting too many pictures of rashes, although we do have drug rashes, but we do occasionally get messages of a scary nature, right? Something about safety, suicidality, things like that. And we have in a group practice setting, like a kind of a crisis group where we can kind of summon the sort of A team of people that are maybe a little bit more skilled at dealing with higher acuity who can weigh in, right? So maybe whoever is that primary clinician is on the front lines working with that individual, but we can get some assistance and some other eyes on the case when we need it. And similarly, like admin staff, they may be the first ones to see something, right? They may, patients aren't always that great of knowing who to reach out for what. So they could reach out to the front desk saying they're suicidal, and that clinician that works with that patient, it may not be totally obvious. So they can just use the crisis page, and whoever is able to help will kind of rush to help. So it's absolutely instrumental. It's one of my favorite aspects of Spruce.
Awesome. Now, Dr. Couturier, I know that your practice is smaller now, so this might be something you're using in a different way. It might be less relevant for you. Do you take notes internally? Do you make use of that part of Spruce as well?
Yeah, absolutely. So I have a solo pediatric practice, and I actually don't have any staff. So Spruce is in general vital to the administrative work. But in terms of internal communication, I do have a covering doctor. And so when she covers for me when I'm on vacation or sick, she's able to send stuff to my inbox when I get back, and it doesn't clutter the incoming messages that are coming in. And so we're able to tease out what's acute and what needs to be dealt with now versus what could be dealt with later. So she's able to send me follow-up conversation assignments. So when I get back, I handle those. So that's nice. And then I do take notes internally if there's a patient that I need to remember who they are, and they're not yet enrolled in Spruce. Maybe they called in and they're interested in a service. I may type in something, this is a mom with 3 kids interested in care, or interested in, ear piercing or whatever else I do. So I'm able to take notes in there.
Awesome. So that's actually a perfect transition to talking about contact management. So contact management in Spruce, I think this is an area where we're really continuing to develop and think about how we can best serve the customers that we have who do work with families. One thing that I know some of you are doing, if you have one phone number that's associated with multiple different family members, you might be using the function to set a name so that phone number is called Brown Family. Another thing that some of you may be doing is using this subject line so that you can say, the child's name underneath the parent's name so that that's more obvious in your inbox. This image here is showing the use of the regarding function, which is another one that I've been working with some newer practices to try out, where they list the patient, the child, as regarding in the conversation with the parent, so that the child's contact card actually has that parent's conversation linked into it. So that's another one, which I think for an established practice is a little bit of a deep dive to go in there and make changes if it's not something you're already using, but I think is a really nice way that we are working now to keep that communication consolidated. So in this example, if Mary Smith is the child and there was a separate conversation that was with her other caregiver, that might also be listed here so that you could see both of those conversations in one place. I know that Dr. Herbsman is definitely doing a lot of group messaging. And I know Dr. Couturier, you've said that you also are doing a lot of group messaging with multiple caregivers. Can you say a bit more about how people are using that currently?
Mm-hmm. Yeah, I can go first. So regarding group messaging, for all of my patients, I try to have all parents and caregivers. So even if it's more than two parents, sometimes there's divorced families, and then there's actually like 3 to 4 parents in one case I have. So it's really nice to be able to create different threads. And so I have some that are grouped with all the caregivers, some that are just with mom and dad, and some that are just with one parent, whatever their preferences are. And so that's something I ask up front when I enroll somebody, so that way we know how they want to be communicated with. So that's one of my favorite things. It's great for the families because they don't have to repeat themselves. So say the mom brings in the child and it's a rash, and I say all these things, it's fine right now, but if it gets worse, and all this anticipatory guidance, I'm able to type that up, especially when I know that parents are handing off the kids, like the next day dad will be with the kids. I'm able to summarize that right in there, and everyone can read and be on the same page, and they're not again eliminating those errors in communication and transferring like different medical information. So that's been huge. I've had nearly 0 medical mistakes due to poor communication, which in my old practice, when I didn't use Spruce or an avenue like this, it would happen all the time, like every week. I'm like, that's not really what we said. Okay. But here, because we're able to text and people can reread later, it's just been amazing. So I probably could do better with my contact management. Just with my small practice, I know everybody and I know all the parents' names and the kids' names. So I'm never confused, or I've never sent the wrong message to a family yet. I'm sure it'll happen, but I haven't done that yet. So, but I'm sure I can go in there and edit it and be a little more specific there.
I can add a little bit about kind of contact management for both teenagers and younger children. But one of the things that we've found and had to bake into our workflow is, a parent will call to book an initial appointment and get onboarded, and the parent is probably the number that we're going to have in the EHR and for billing and all of that. But then when it comes to see the patient, maybe, for a follow-up, the patient's running late and the patient's like 17, and I go into Spruce and the patient is not listed. So now we've really had to bake it into our onboarding workflow that for a teenage patient, like, please be sure to get the name of the teenager. And if they have their own cell phone, make their own contact. And then you can use the regarding function to associate that parent. And then I think for a younger child who doesn't have their own cell phone, you still can make a contact for them and have these regarding for the different parents. But that way, if I want to do something regarding, little Johnny, I don't need to remember the mother's last name, which may be different. I'm just going to go into Spruce and search for the patient's name, right? Because the patient's name is what's in your EHR. So we really need to have a 1-for-1. Every single patient needs an entry in Spruce, even if they don't have their own phone number. And I think this is a really nice way to do it. Before this, patients could get named, like a parent could get named as the patient, and that would result in some awkward back and forth.
Right.
I think our situation was a lot worse because we have adult as patients, adult as parents.
Yep.
God help me if it was a blended family, then we had the stepmom, stepdad, and always a nanny. And all of them would communicate and it would get really, really confusing going by last name. So we started off not right. So I recommend whoever takes on Spruce to really rely on the specialist to set things right. I don't know how we did it, but one thing that happened last year, which was wonderful, I used to get texts from parents, sometimes about their own personal problems. And as a pediatrician, I'm really, really unhappy about getting GYN questions, for example, or prostate questions. And my adult partners are very unhappy about seeing diaper rashes. So it was really, really important to clean it up. So when a parent, I don't know how they do it, but now when a parent sends a text to the adult doctors, it goes to them. I never see it, and everybody's happier for it. So if you take care of a whole family, then they've really given us a lot of tools to just clean it up. So now I will say nanny for the Sanchez family about Johnny. So it's like that much specific, which is great.
And I think that's a perfect transition actually to talking about using secure messaging with patients. I know that what your practice is doing, Dr. Herbstman, is having different Spruce links for different doctors. So you're each able to have your own conversation. So you have a pediatric conversation and the internal medicine doctor or the GYN has a different separate conversation. And since we're able to divide out those conversations, that's helpful for the patient, but it's also helpful for the practice to organize that communication. It's another way that we are working to try to make it possible for practices like yours to really use Spruce more successfully. The other thing that you can do, which I've heard some pediatricians really like, is create different conversations using the same link for different children. So if you wanted one conversation about Mary Smith and a different one about Bart Simpson, those can be with the same link. But as you can see in this image, this is how this would look for the patient. They might see these 3 different conversations. So the first conversation I'm imagining is with their internal medicine doctor, and the subject line there says Dr. Gulish, and the others are about the 2 different children. The subject line says the different children. Now, this does require a little bit of compliance on the patient's part to choose the right conversation and continue the conversation where they should be continuing it. I do have some practices tell me, my patients just don't do that. They just send a message wherever they want to send a message, and they don't do that. It does sound like for Dr. Herbstman, your practice has had a lot of success with having these different conversations, and that's working better for you. So hopefully other people's patients will also choose to be compliant with this. I think it's always a little bit of an education thing.
I would say this. I live and work in San Francisco. So many of my clientele invented the internet literally. So being tech savvy is not a big issue for them. We are trying this out in some of our practices that are predominantly geriatric. And I think it's working well. I think because everybody's used to my chart and this and that, that I think it's working really well, even for the older population, both in terms of convenience and how easy it is to use. So for all that's worth.
That's great to hear. That's great to hear. So yeah, securely messaging with patients. I mean, there are so many great bells and whistles to this now as well, including being able to send video and send photos. Dr. Couturier, you were telling me this morning that this allows you to diagnose group so that you don't have to have people in.
Yeah, it's been great. I feel like I can triage things faster than any other avenue in healthcare right now. I mean, so a family of mine, this happens a lot. Well, and I've educated them that if you hear, a croup noise and you have a young child, I want to confirm that and probably see them just to be on the safe side. So oftentimes they will send me videos of their child coughing, even multiple videos. So that's really helpful for me to be like, hey, let's meet up in an hour, or I don't like the sound of that. Let's, we need to meet up, or, oh no, that's actually not croup. That just sounds like bronchiolitis. We'll talk about that. It's just really nice to be able to quickly triage the patient just with whether it's a picture like a rash you're saying or a video. It's been great. It's been really, really nice.
Michelle, is this an okay time to jump in with a couple of questions that came in?
Yeah, please go for it, Carrie.
Okay, perfect. So Jeff wrote in and asked if we could demonstrate the example that Dr. McMillan mentioned about labeling the 17-year-old regarding on a mom's contact. Jeff is a family doc and has both parent and child as patients.
Yeah, so this functionality is in the conversation thread. So if you have open the conversation with the mom and you want that conversation to be regarding the child, if you open up that information panel that you open by selecting the little I in the upper right, you'll see this information panel, and one of the sections there says regarding. And automatically you're going to see the name of the person the conversation is with, but you can also add another contact there. So like in this case, you can see this conversation is with Sophia, and I've added Mary Smith under regarding, with the understanding that that's the child that this conversation is about.
Perfect. Excellent. Hopefully that answered Jeff's question. Thank you for that. And one other quick one from Dr. Allison. For those of you on the panel who message nannies or caregivers, do you keep an ROI on file for all contacts?
Return on investment? What's an ROI?
That would be my interpretation, because I work
No,
in
Release of information.
Release of information.
Yeah.
For the record, sure, yes, absolutely, because that's the legal thing to do. Am I really religious about it? We sort of have the relationship with the patients that, I'm sad to say we have a slew of children being raised by nannies who know more and make more decisions about the kid than one should. But yeah, I mean, it's a fair question and we should do it. The other question, which is a Pandora's box for us, when we started, most parents liked it more as texting than secure messaging. And we've had, because they got so used to it being a text, that we're struggling with converting it to secure messaging. So our new practices that are using it straight from secure messaging, not offering as a text. What my practice in San Francisco is doing for over 1,200 patients now is painstakingly collecting waivers that if you're using text, you are not using a secure messaging. And that was sort of the one thing that may be something to look at from Spruce, is somehow helping us keep track of that. But yeah, release of records, because sometimes we'll have grandparents covering for a holiday. I have an email at somewhere from parents or nannies that it's okay, but I don't store it as carefully as I should. But absolutely, you're right. We should do that.
Yeah, and I would say in psychiatry, we do those release of informations if somebody is going to be more involved directly in the care. But we also do have situations where families may have, an assistant or something like that, where we're actually, they don't really need that type of information. So we'll sort of say in the Spruce contact, maybe in parentheses, like limited ROI, like scheduling only or something, right? So we know that we're not supposed to be sharing a bunch of stuff with them. It's the absolute minimum that they need to actually just do their logistical, or billing only something, right? Dad pays, but that, it's an adult person, and dad is not to know about all kinds of stuff. So we get into the weeds with that. I will say one thing about the secure messaging that I think, like Dr. Herbstman, a lot of patients, they just are preferring SMS. It's easier, right? None of us really like to log into a portal, but I am becoming more bullish on secure messaging over time, because recently this year, a lot of there's been some regulations, and a lot of the telecommunications providers have put in rules that SMS can't contain certain words, and they can be words like Ritalin and Adderall. And so I've had patients try to message about Adderall with SMS and have it be blocked. But with secure messaging, that is not subject to the same regulation. So if you're needing these, situations where you're needing to actually talk about drug names and things like that, then secure is definitely the way to go.
Yeah. Thank you for bringing that up. I think I actually, originally had a slide about SMS texting with patients in this presentation, and I removed it because I have found that for pediatrics in particular, SMS texting is not a really good way of communicating with patients for most practices. The secure messaging allows parents to be sending photos and videos, and that's just absolutely not something that they really should be sending by text message. You're going to send a picture of diaper rash. Please don't do that by text message. It's not a good idea. Don't do that. So I think that in this particular use case, in terms of messaging with families, the secure messaging is a much better solution for patient communication. And it's true that also we are seeing these regulatory changes that are limiting communication through SMS and are causing more issues for some other customers who deal more with medications that are coming up as triggers.
And secure messaging also allows you to have group threads and conversation. SMS does not, which parents just like, yeah, me and my husband are on this thread, but the husband wasn't on this thread. And then he asked the same question 10 minutes later. And so that's one of the ways we're encouraging people to do secure messaging, is because they think of it as texting, but it's not really texting. It's Spruce on our end, it's texting on their end. And secure messaging allows us to be sort of more on top. I think the other feature that you may or may not have covered, which I should mention, because we have so many calls scheduled, and we also have sometimes offices down south of us covering, the ability to auto forward your phone and your messages is so nice. I mean, I still remember the days when I had my own personal cell phone and I would forward to my partner, but then if my wife wanted to reach me and I was forwarded to my partner, it added interesting conversations. So I think the ability to read each other's messages and auto forward phones, like we have a call schedule basically, and I just click it over. So on more pitch.
And you're covering all my transitions for me today, Dr. Herbstman. Yes, so I think that is another aspect of Spruce that I think all of you are using in unique ways that is really helpful for communicating with families, is having different kinds of call handling and auto replies to set expectations around when they can expect to hear from you, how they should communicate with you in different settings. And then, my slide after this also is about coverage as well, which I know several of you have brought up as being a really important aspect of this for you. Do you each want to talk about how after hours works for your practice?
Yeah, I can go first. For after hours, I have an auto text message that I created via Spruce using a tree. Actually, I did the tree and then I changed it back because this was a little bit more helpful. So for anyone who texts after 7 p.m. and before 7 a.m. Monday through Friday and on weekends, then they get an auto text saying, if this is an emergency, you need to call. And just for liability wise, I find that it makes me feel better that they heard that, they saw that message, it's written there, that in case something does happen, it is up to them to take the next step and actually phone call or call 911. So I love that. The auto text for after hours. Before that, I did have a tree where if you were a patient of mine, you pressed 1. If you weren't and this was non-urgent, you pressed 2. I just found that it was more messy for me on the back end, just because I don't have the volume to really sift through that. So it wasn't just unnecessary. So I just have the auto text right now. I do have a phone tree though. So if you call after hours, it will ask you that press 1. If you're a patient, press 2. If not, so it's kind of different. You can automate it. You can automate your auto replies, and it's separately for phone calls and texts, and so that's kind of convenient. I also do auto. I don't know if this is the right section, but saved messages for repeated situations. So like I have different services I offer. I do like medical ear piercing for patients, and so whenever I get a text message for that, I have an auto reply that says, "Hi, so and so, I would love to. When do you want to schedule?" So I don't have to type that every single time. Same thing with common colds and other common pediatric scenarios, rashes, or and then being able to future text the appointments reminders as well. Sometimes I do that, or just follow up on a patient that I sent antibiotics for. So being able to send a message like Friday saying, "How is Johnny doing?" It's just really nice. So for all those auto features, it's been really helpful.
Awesome.
Yeah, I can talk about this. So I think in a mental health practice, setting appropriate boundaries is a kind of core part of the work. So we put a lot of thought into our auto responses, and I think it's on the level of each clinician having, some standard stuff, but their own little flavor. So it does sound like it is, in that person's voice. And then we have some for the main numbers. I do direct people that if it is urgent, that they can call and press 1 to get that kind of urgent push to my personal cell phone. The vast majority of people do not misuse that. Occasionally marketers and stuff misuse it, which makes me very angry. But for the most part, it's only used for true emergencies. And then I do appreciate one of the things with the auto replies on nights and weekends is there is some kind of throttle on it. So if a patient continually messages, they won't get it like over and over for a certain period of time. Like if they do an hour later, they will, but it doesn't just sort of get some crazy loop. They can still be like, I know you're not going to see this until whatever, but they're going to send whatever it is that they're going to do. So I like that. I also really like the being able to schedule, because sometimes honestly, a patient messages me at 10:30 at night, and it's easier for me to just take care of whatever it is then and there. But I don't really want to know them to learn that messaging me at 10:30 at night is going to get their needs met. So I will do the thing and send the message for 9 a.m. and say, I've sent your script in, or yes, we can meet then, or something like that. So I absolutely love that as a psychiatrist to help shape behavior around when it's appropriate and when it's not to contact.
I can speak to what happens when you don't have boundaries. And also we have a robust system. So we have 3 adult medicine doctors, 3 pediatric medicine doctors on call. And so we take text because of the nature of our job till 10 o'clock at night. So if you text us after 10, you will say, we will not be receiving messages between 10 and 8, call if this is urgent. Surprises me how many people don't read that and still message an hour later. But still, so they know to call, and that kind of triages the emergencies. So we have this for basically when I'm on for the night, my 2 partners sign out to me via the internal messaging, and then I'm just responsible to read their messages and threads. And if it's something I don't need to deal with, because San Francisco mom feels like 10 o'clock at night might be a really good time to discuss when to introduce solids. And so I do message my partner. I'll say, this is a great question for Dr. Castelli tomorrow, and they'll receive it. We also use the scheduling messages. I even use it like when I give vaccines, I'll do an automatic schedule message. Hey, how's Johnny doing with the shot, side effects, 2 days later or a day later. So it takes it off of me to remind them to do that. And weekends are the same thing. There's a lot of internal messaging, keeping doctors not covering on tap, so they know that when they're off on the weekend, they don't have to worry about anything. Everything's taken care of, and whatever they need to know. That way, instead of going through 200 messages on a Monday, you only go through the 6 messages I flagged for you. And you don't have to clear everything because you trust your partners. Yeah, so I think that's pretty much it. People call us, and because we auto forward phone, they don't have to have an on-call number. They just call my number, or my Spruce number, and that goes to my partners when they're covering me. And then we do use auto replies just for, we don't check text and this and that. Since we're 24/7, we don't really, if I was in solo practice, I would have them on call this weekend, call this, call that. But because we're always covering them, we don't really use auto replies individually. We use auto replies, just don't text me after 10 o'clock and before 8 o'clock. So that's it.
We have a quick question from Alicia. She's wondering, how exactly do you auto forward messages and calls?
Oh, I don't suppose I can share my screen, but it's really easy. I'm a boomer, so I would say it's a baby boomer proof system. You basically, I'll go on notifications and I'll click on my partners, so I get their messages. So every time a patient sends them, it alerts me. And then when I want to auto forward the phone, I'll go to phone and messaging, and then it said numbers to ring. And usually it rings my personal cell phone because that's how I get the messages. But then I can click on office tab or on my partners tab. Sometimes, like I was on in a conference recently, so I have my phone on, but I had my partner's phone on too. So he got it first. And if he didn't pick it up, then I got it or something like that. But it's really like clicking buttons. And it's pretty easy. I don't think I can share a screen, but I'm happy to do it if that helps.
No, that was terrific.
I think that was great. And there are a lot of ways to do this depending on how your Spruce is set up. So we'll go to our coverage slide here. If you have a phone tree, you can have an after hours tree that it switches to automatically, that sends calls to a different place. We have some pediatric practices that use like an on-call nurses service after hours, and calls can be forwarded to an outside service if that's what you're doing. It's also possible to have individual phone numbers, direct lines. So for a direct line, like Dr. Herbstman's, he can choose to have that ring to a different person instead of to himself, and he can toggle that on and off. There's definitely a lot of flexibility within the system depending on how you're choosing to set this up. And there are different degrees of automation. So you can do that manually, like as you're describing, like I'm toggling off because I'm, out for the night, or it can be something that's linked to your hours that you have, all set up to change in advance. So I think for each practice, they can really work out what makes the most sense for them. But the other thing to cover, here on this slide is coverage. Which is a huge aspect of this as well, whether it's somebody within your practice that's covering for you, or if you are adding someone else to your Spruce temporarily to cover for you and you're a solo practitioner. So I think having all of the patient communication accessible to someone who's covering is a really big change for a lot of providers that I speak to who are used to having to cover for someone without any kind of context in the situation. So I think that's one way that I think Spruce is really improving this kind of patient care. But it also, I think, is really great for providers because they can actually step back and say, I know that I can really be offline and, go to Hawaii and have that nice trip because my partner is actually able to cover for me. They have, everything that they need to be able to cover for me.
We do not use a lot of the automated ways of doing it because our schedule is made up the week before, so it's too much of an effort. But if I knew that I was off every Tuesday night at 5 p.m., then I would certainly plug it. I think the other thing is, I'm not sure you covered it, and maybe it's obvious, but Spruce is both on my desktop and on my phone. And since we do a lot of house calls, super helpful to have it on the phone too. And I will say this, that we also use the saved messages for sure. One of my partner is a tremendous over explainer. So every time he responds to what do you do for constipation, I just save it as a message because his answers are amazing. The other thing is you can attach things. And so sometimes I'll attach, Seattle Children's has a good I'm picking on constipation for some reason, but Seattle Children has a good protocol for Miralax, so I'll attach that handout and stuff like that. So I don't know if we can automate that, but that would be lovely. I literally always dream of, I don't know if you guys remember Movie Phone. You call
Mhm.
that punching your zip code. If you're calling about, Maverick, press 1. And then I was like, if you're calling about constipation, press 1. If you're calling about runny nose, press 2. And I would love for that to be automated, but maybe that's 3.0.
Well, I mean, we can build that kind of automation, but I have to warn you, your patients may not prefer that. Sometimes patients don't like automation quite as much as providers. They love to feel like they can contact you directly. So it's always a little bit of a balance to figure out how much you can automate before they rebel against you.
I have a couple of questions that just came in. Is now a good time?
Yeah.
Okay, perfect. The first is from Jeff, and he is asking if a patient texts after hours, he has an automation asking them to text urgent if it's urgent. Once they do, he gets a text message on his regular iPhone text app. Instead, can he set it up so he can get a phone call instead of a text?
It's not possible to set it up as a phone call right now because we don't have the computer robot functionality to have a robot call you instead of sending you that text message. I would say if he really wants patients to call, he could include in the automated response that they get that they should call if it's urgent instead of texting. If the concern is that he's not getting that alert, or that alert is like not loud enough to wake him at night or something like that, we can set up a workflow that will continue to send that text message to him over and over until he resolves a page internally. So I can set that up so that every 15 minutes it texts him again and is like, you still haven't looked at that urgent message. You still haven't looked at that urgent message, until he goes in and resolves the page to stop that workflow from continuing. I do set that up for providers who really want to make sure that like they're woken at night if it's an urgent matter, and it's important that they keep being notified in case, they don't immediately wake up. So if he wants that, tell him to reach out to Spruce support and we will set that up for him, and he will be bothered by text messages over and over again.
I would like to get that set up for my husband. I will be in touch.
Do not wake up Owen. Don't be ridiculous.
Can I just have a quick question actually about that urgent, because my auto response says to call and press 1. If people just put this instruction to text urgent, is that something you have to get set up and ask for from Spruce, or is that sort of built in already?
No, so that's something that you have to ask for if you want there to be a button response like that that's set up after hours. It is a pretty common one that we set up. I think all of these types of automations are really useful for managing patient expectation and behavior. So if you want to respond to text messages, or you want to respond to secure messages that are sent late at night, and you need to receive some kind of added notification because otherwise you won't be aware of them, we can build that for you so that you're able to respond. You can also, choose to set up a simple autoresponder that just says, for urgent matters, please call, so that you're putting it a little bit more on your patient. Like, okay, you sent me a secure messages late at night. I'm not going to see this.
Right. That's what I like that. Yeah, because I
know.
won't necessarily wake up, but I'll wake up to a phone call.
Yeah.
Nice.
So I think like last year I had set up an auto reply saying, click the button urgent. And I got a lot of patients clicking that just because it's so easy. So I took it away, and now it says to call me, and it does the whole thing. You've reached, you have an urgent message that somebody called and hit number 1, which is urgent. And then I got a text that says urgent. So that's how I do it now. And it's been great. So.
Yeah.
Yeah.
I like that.
I think now that I am a nervous parent of a small child myself, I have much more sympathy with pediatricians when I'm trying to figure out like how they should set up urgent for themselves, because I know that everything feels pretty urgent to me in the middle of the night. And I'm sure that that's true for a lot of the parents that you work with. So I do think it's important, for your individual practice to figure out how you want them to communicate to you when it's urgent.
Mhm.
And I think ideally there should be one way. You don't want to be getting like both urgent texts and urgent calls. Like there should be
Mhm.
one way that you expect them to communicate something urgent to you, and have the communication that you give them, structure into them doing that thing that you want, so that you're not feeling overwhelmed by different kinds of urgent communication.
That makes a lot of sense. I have one more question for the group. This is from Anna. She's asking if a patient has left a practice, is there a way to provide an auto reply to that individual patient? In other words, can an auto reply be targeted towards certain patients?
Yes, that's a great question. So you can set up an auto reply, and this is true even of the self-service auto replies that you're building on your own, for text messages or secure messages. If you're looking at auto replies in your settings, you can build an auto reply based on a tag. So if you tag patients who have left your practice with inactive and they send you a message, you can have an auto reply that's triggered that says, hey, you've left our practice, so the procedure will be, like XYZ, this is what we want you to know. If you're looking for something that is in response to a phone call from someone who is inactive, that's something we would have to build for you, and can be a little bit more finicky. If you're looking for a response to a phone call, I would want to have you talk to someone into support about exactly what it was that you wanted it to do. But for those auto replies for a text or a secure message, that's definitely pretty easy for you to do on your end with tags. And I think that's a really good reason to tag anyone who's left your practice with an inactive tag. This is also really helpful for bulk messaging. If you're going to send bulk messages, you want to be able to distinguish the patients who are currently active, so you can send that message only to them.
That's excellent. Sort of on the heels of that, is it possible to delete a contact? Kelsey is asking.
So it is possible to delete a contact that does not have a Spruce account. If they have set up a Spruce account, that Spruce account belongs to them. It doesn't belong to you. So you can't delete it because it's their Spruce account. So it will remain there. You can mark them as, inactive with a tag. You can also go into their conversation and mark that as read only if you are not interested in communicating with that person further. But the actual account, which is represented by that contact card that you see, is their Spruce account and isn't something that you can delete as the provider.
But read only would prevent them from continuing to message the practice.
Yes. Yes, read only would prevent them from communicating with you securely. Read only, like you aren't able to, if you want to block their phone number, you can also do that, but that's a separate action. Okay, well, thank you all for being part of this. Are there any other aspects of this you wanted to bring up, or hopes and dreams for what you would like for us to change about Spruce for you?
So I have one use case that I've been using as a psychiatrist that I think would also apply for pediatricians and other specialists, which is that if I have a patient seeing a therapist who's also using Spruce, we do have some group messages, secure group messages that include the patient and the therapist. If the therapist is not already using Spruce, they can be invited, just like a parent can be invited, but that's a little bit more activation energy. And so I've always been very interested if there are pediatrics or other types of medical practices and we're sharing patients, that I do think that secure message is a really great way to collaborate and also include the patient, like a warm handoff, a referral, etc., as well as for private doc-to-doc communications across practices. So I think that's kind of underutilized, and we'd be using it more for those of us who are Spruce fanatics.
Thank you for bringing it up. Actually, if any of you I know have not tried what we would call secure clinic-to-clinic messaging, reach out to another clinic that you know uses Spruce. I would be happy to share the information about this. It looks just like your conversation with Spruce support. So your conversation with Spruce support is actually a clinic-to-clinic communication between your clinic and ours. So if you have a clinic-to-clinic communication with another provider who's using Spruce, it would look like that. It would show their little icon or the clinic icon, and you can use them in group conversations, just as Dr. McMillan is describing. So if you're referring to someone, you and the patient and that other provider can all be in one conversation.
I do have one wish list, and we've talked about it, so I'm going to throw you under the bus, which is we are on Athena Medical Records, and it does not sync with Athena Medical Records. We used to be in Elation, and you can literally sync threads into patients. So I can't tell you how many conversations I have, like, Johnny has pink eye, here's a picture, great, I'll send you a fluoxetine, what pharmacy? Then I have to remember that the next morning and put it in the chart. Now with Elation, I could sync that thread into the chart, which was convenient. It appeared as a note. It doesn't work with Athena. So we request and we're told that that's technology exists, but all these conversations are in limbo unless we can put them in the EMR. And if we have to do, and so I end up doing is I'll do a case in my EMR and I'll say, I prescribed, because I have to prescribe from the EMR. So I'll put a case that said, this is my conversation, and I'll import the picture from Spruce. But it would be nicer if it was 2 less steps and I can just click on a button on Spruce and it would migrate it over to Athena. Then it would be perfect, because it's much better to use Spruce, more convenient than to use the EMR patient portal. And so it would be nice. We haven't used, there's also a telemedicine component. I've used it a couple of times. It's basically like FaceTime, I guess, more secure. But I think that's also there. The EMR also has telemedicine, and I'm a pediatrician. I rarely do telemedicine other than to, do group tests as an example, or walking somebody through reducing a nursemaid's elbow on a good weekend. Other than that, no, we love it. We've been with it for 10 years, and when it's become, and the nice thing I'll say, Spruce has grown with us. They listen to feedback and they help us grow and they help us correct. And, we're always learning about new aspects of Spruce we didn't know about. So the reps are very communicative and very responsive. So it's been wonderful.
Thank you. Well, thank you all for sharing how you're using the product. It's incredibly helpful for us to understand, what the needs of our providers are, and also to help us in, the way that we guide new people as they're coming into Spruce as well.
Yeah, this has been incredible. Thank you all so much for joining, and Michelle for leading. I learned a lot from this session, and I know that everyone who joined us today stuck with us for the whole hour. So that says a lot about what we covered. Reminder, I'll be sending out the recording later this afternoon. So if you want to revisit anything, you'll have that to revisit. Thank you guys so much. Have a good rest of your day.
Thank you.
Thank you.
Bye.